Good evening. Welcome to Sound Health on Lagos Television. I am Ola Sumbo Mudupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we try to enlighten members of the public on trending health issues from around the world. Today, we are looking at the ongoing measles and rubella vaccination campaign recently launched by the federal government across Nigeria. This is our focus today. Please stay tuned. The conversation begins after this break.
Kamal will die at 49. Lucy will die at 52. Ashley will die at 57. Fatima will die at 59. Ethan will die at 63. A privileged few will be healthy enough to live sometimes decades longer than others, particularly those with access not just to healthcare, but resources like housing, education and jobs. This is what health inequity means. To change this, we need to be all for equity.
The program is still Sound Health on Lagos Television. Join us via Zoom this evening to enlighten us about the measles and rubella disease and efforts by the federal government to achieve herd immunity through the ongoing measles and rubella vaccination campaign is Dr. Folake Kofo-Idowu. Dr. Folake Kofo-Idowu is an infectious diseases specialist. Good evening, Dr. Kofo-Idowu, and thanks for joining us.
Good evening, and thank you for having me.
All right, thanks for always finding time to join us on the program. Tell us, what exactly is measles and rubella? Because the federal government just initiated a vaccination campaign for that purpose. Let us know what exactly is the measles and rubella disease.
The MMR vaccine that is currently being re-pushed, I wouldn't say pushed because it's been existent, is meant to prevent against a group of viral infections that is measles, mumps, and rubella. And these are viral infections that can affect anybody at any age, but more importantly, it's more transmissible among children, and it has more complications and are very debilitating with children. For instance, rubella, if a mother catches it while pregnant, it can cause stillbirths, it can cause genetic deformities in children. For measles, there's so many complications that could arise from it. It can cause encephalitis, which can cause permanent brain damage. There is also a late complication. So someone could have measles now. In the next few years, they seem like they are fine, but gradually the effect of the leftover of the virus in their brain can continue to have inflammatory changes, and it can cause what we call a subacute pan-sclerosing encephalitis. So basically, it's causing all parts of their brain to fibrose, thicken, and die off, and that person will just end up in a vegetative state for the rest of their life till they die. So all of these things are important cumulatively, but there are also so many other things because our DNA is different, everybody's baseline is different. So somebody who has a little bit of kidney dysfunction, who is diabetic, they can have measles or rubella, and now that shakes them more than the other person who doesn't have a lot going on. We don't know what is going on at baseline with everybody, so the best thing to do is to prevent for the whole community and make sure that there's community immunity or herd immunity levels is high for everyone, and that reduces transmissibility and reduces the chances of people getting this. So that's why the rates are beginning to come up because of vaccine resistance and vaccine rejection in certain areas. So that's why the government is just bringing up the campaign again so that we can re-educate people and remind them, as human beings, we forget. When we haven't seen something for a while, you wonder, oh, how bad can it be? How bad can it be is because we worked hard to stamp it out and you've forgotten. So I guess it's just meant to serve as a reminder.
All right, before we talk about prevention, how to achieve herd immunity through prevention, let us look at symptoms of measles and rubella. Are the symptoms the same?
They are similar when starting, but the rash is slightly different. For most of all the viral infections, when they are starting, people tend to have like a flu-like, what we call a flu-like symptoms, which is they feel unwell, like what we call malaise, might have a little bit of runny nose, and many times there is an amount of fever. The height or the peak of the fever would vary with each person, and it's usually at the height of the fever that the rash comes out. The rash of measles comes out at once, and it's described as papular, where it is raised. It is skin colored and it is raised on the skin. Unlike some other rashes that are flat, or like chickenpox rash that is a blister, which is like a bubble with liquid in it. And rubella too is similar, but the rash is just slightly different.
All right. Oftentimes we see adults come up, grown-ups come up with measles. What does this mean? Is it that most of these category of people didn't get the MMR vaccine when they were young? And how do we ensure that this is prevented?
I know that in our part of the world, MMR, and in almost everywhere in the world, MMR vaccine is part of the childhood vaccination package. Everybody should have gotten it. Unfortunately, yes, some children can get it before the scheduled time. They can get the infection before the scheduled time. That happens. The adults that get it, it's either they were not vaccinated, which depending on which area they're living in, may be unlikely, but if it's in the areas where vaccine rejection is high, then the chances that they were unvaccinated is high. That's one. Two is that they have an immune deficiency. So they have a condition, whether diagnosed or not, that has removed their immunity, or that has removed their ability to produce the proteins that protect. Because what the vaccine is meant to do is introduce a sample or a lookalike of the vaccine, of the virus, into your body, and it trains your body to produce soldiers and chemicals that would attack. So it's basically like war training, because you're training soldiers for war does not mean there is war. However, if you do not equip your soldiers, right, or you don't feed them and they are hungry and they die off or they are sleeping, then when the infection comes, you cannot fight. So people who have conditions where they are malnourished, they're not producing protein, because antibodies are proteins. So if somebody is malnourished, their protein levels are low, their immunoglobulin levels will be low. If you have conditions that suppress the cellular immunity, so the cells that are meant to fight or produce the antibodies are weakened, then the person's immunity is weakened. And sometimes, the cells are there, but there's something blocking the responsiveness. So chronic conditions like diabetes can affect the immunity, but not in that way. But people tend to even have things that a lot of times go undiagnosed. They'll just be like, oh, I'm always feeling unwell, this person is very sickly, or this person is always having certain types of infections, and they just go undiagnosed. Or person might have an underlying cancer that is growing and they don't know, and it's when they now have this and they are wondering. The last part, which is not common, especially for the MMR, is just a natural loss of immunity. That has not really been found with in relation to the MMR vaccine for things like DPT, tetanus, diphtheria, pertussis, where we are recommended to get booster doses. It's because it's been shown that yes, the immunity for that can drop. It is not impossible, obviously, that people lose their immunity maybe just from aging, environmental factors, or again, poor nutrition. But again, overall, that is not something that is commonly found, but that's a possibility of what can cause an adult to catch the measles or rubella after they've been vaccinated in
at a young age.
in childhood. Yes.
Okay, I'm glad that this vaccination, the vaccine is part of the routine immunization. But how do we address myths and misconceptions about vaccine hesitancy? Because it is still ongoing in the society, especially hard to reach societies.
It is not an easy answer. That's not an easy question to answer. But one thing that I know is community participation is something that works. You have to reach out to people and communicate to them in ways that they can understand. And I think there is a bit of arrogance on the side of medicine where we just feel like we know and we're just telling you. But we're telling you the way we know it, right? And we're speaking it in our own medical jargon language. And so we need to bring it down to the community level, bring community members on board, let them be part of the education and information design process, right? When people who understand the culture or the subculture of a region are part of a design, implementation design, I feel like it makes more meaning and it makes more impact because they take ownership, because they understand the nuances. They understand, oh, if this person is speaking, there are communities who will tell you they don't like certain colors. So imagine you're putting someone who's talking to them and the person is wearing that color. There are communities or there are cultures where they believe that when a person is having fever, you give them something cold and you are bringing an antibiotic and you're telling them, yeah, just put it on the table. No, but when you know that, okay, it doesn't hurt to put the antibiotic in the fridge, you tell them, oh, just put it in the fridge. When you're about to take it, then you bring it out. You've kind of integrated their own belief into the implementation process. So it is about, one, understanding the culture of the regions that are hesitant, understanding why they are hesitant, and then bringing community members on board to troubleshoot those concerns and build a plan that is culturally sensitive and acceptable to the communities in question.
All right, what measures should be in place? And let us also talk about the target communities now during this campaign period. What age group should get this vaccine now during this campaign?
Anyone that has not been vaccinated obviously should get it. Children, I think the schedule that has been created still makes sense. It's just ensuring that it is adhered to. Children who have missed doses should be scheduled to get catch-up doses. So the same schedule that that is there works, but the government would have made provisions for complementary vaccinations for people who have missed or people who have not gotten vaccines of their vaccination at all.
All right, so let us talk about measures to put in place to ensure that more people get on board as we begin to wrap up this interview.
It's just education. Again, yes, there will be targeted education towards the communities that have vaccine hesitancy and vaccine resistance. We do additional education and informationals for them, but the entire nation needs to be. Thankfully, Nigeria, on the average, we're not, the larger populace, we're not rejecting vaccines, but there are other countries where, there's now a lot of vaccine rejections and people will tell you they'd rather have their child have measles, and you're looking at them like, when that child is on multi-organ failure and on the vent or needs life-saving things, then you will bring them to us and, start acting up. But everybody still needs to be educated. Everybody still needs to be reminded it is important. And I think these things should be ongoing, continuous education. These are things that should be taught in schools. There's primary school, secondary school, based on their understanding level. And, secondary schools, everybody should be educated. It should be on the news. It should be on TV and that.
All right, let us quickly talk about the consequences, the overall consequences of not meeting the targets of this campaign.
it what happens with vaccination, the goal of vaccination, aside individual prevention, is really creating a community level of vaccinated people, right? And so that's what we call herd community. So when we don't hit those numbers, it just means that our herd immunity is lower, and that just increases the chances of transmittability. And so that's just what it means. And so women who are pregnant have to be extra careful, because the mother, depending on her immune levels, pregnancy also lowers immunity a bit, and the child can become infected in utero or shortly after birth. So education needs to happen, and it's not even just get the vaccine, it is also what are the day-to-day habits that need to be imbibed for to reduce transmissibility. These viruses are transmitted by droplets, respiratory droplets. So when you're talking to people and microscopically I'm emitting a lot of droplets as I'm speaking, that's why you wear a mask. But imagine I'm sitting in front of my computer now, I have already dispersed some amount of microorganisms to that. Imagine somebody else coming, getting my computer and just start typing. Whatever has been left on my computer, they now catch it on their hands. And then they go somewhere, they touch a doorknob, they've placed it on that doorknob, somebody else comes, touches that doorknob, catches it, and that's how you transmit. And that's why hand washing is one of the very, very, very important things, because you can transmit these things onto inanimate objects and other people can contact it there. So anybody who has a cold, stay away from people. When you are sneezing, don't just achoo, right? You sneeze into your elbow to limit what's the aerosols that you're putting out. All of those kind of things tend to, and if you're sick, stay home, wash your hands, talk to your doctor, use what you need to do. And if you have a rash, definitely, absolutely talk to your doctor and stay away from people so that you don't transmit
All right.
Whatever it is that you have.
All right, in 30 seconds now, as an infectious disease specialist, your final words.
Final words, we need to all protect ourselves and protect our neighbors. Do the right thing. Like I said, wash your hands teach your children also hand washing. It's important. Hand washing saves lives. If you are sick, please stay home, reach out to your doctor. Employers should also be considerate when someone is validly ill, with febrile illness, having a cold, runny nose. Those are very, very infectious things. Stay home, talk to your doctor, get the appropriate medication. And also, as an infectious diseases person, to every Nigerian, what I would definitely absolutely say is all fevers are not malaria. Yes, we are endemic for malaria, but all fevers are absolutely not malaria. In fact, all mosquito bites is not only malaria that mosquitoes transmit. There are arboviruses that cause a whole lot of other things that people can get. So stay safe.
Stay safe. All fevers are not malaria. All mosquito bites do not lead to malaria. Dr. Folake Kofo-Idowu, infectious disease specialist, on the ongoing rubella and measles vaccination campaign. Thank you so much for your time and expertise on the show.
Thank you for having me.
All right, Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. Vaccine preventable diseases are actually preventable when you're vaccinated against them. Vaccines are safe, free, and harmless. We need to start dispelling those myths about vaccines, especially when we need to achieve herd immunity across communities. We have been discussing the ongoing rubella and measles vaccination campaign in Nigeria. If you're experiencing any of the symptoms such as fever, rashes, mentioned by Dr. Kofo-Idowu, ensure you report early to the nearest health facility around you. This is why we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you would like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.